Welcome to this 8-minute video about preventing injurious falls among seniors. We'll be taking a whole of systems perspective. I'm Professor Bill Bellew, and I'm guiding you on behalf of Professors Sherrington, Tiedemann, Bellew and Delbaere. We'll be covering the following: the evidence we already have, whole of systems thinking, how to avoid getting lost in translation, and developing an early systems map of falls, risks and prevention. As I said, we already know a lot about the issue. We certainly know that the cost of injurious falls in Australia is a great deal annually. $4.3 billion were spent on treatment of injurious falls in 2018 to 19. This expenditure increased rapidly from 45 onwards. It accelerated further at 65 plus years. In the 65 plus age group, these falls cost $2.52 billion. From 45 plus, they cost a staggering $3.04 billion. We know a lot about risk factors, assessment, prevention and treatment of falls, not least because of the new publication, Falls in Older People, by Lord, Sherrington and McGanathan. Our knowledge includes dealing with gait and balance, postural hypertension, medication review, vision checks, foot health, and dealing with environmental hazards. Yet despite all this knowledge, somehow much gets lost in translation into practice. We're going to look now at using whole of systems thinking, and we're going to say that dealing with translation of knowledge to practice is part of the system. We can apply several levels of analysis, from individual through interpersonal, community, organizational, and policy enabling environments. But in using systems thinking, we'll focus on integrated rather than fragmented approaches, whole systems perspectives, and not just a clinical focus on individuals, and dynamic rather than static or linear approaches, an adaptive system with feedback loops. The Australian Prevention Partnership Centre, that's their URL on the top of the screen, have provided us with a prevention system change framework. Its 4 key elements involve applying a system lens, keeping a focus on implementation, integrating the system lens and the implementation focus, and developing a theory of systems change. Why and when is a systems approach important? It's important when we're dealing with long-term or complex challenges, when there are multiple actors and influences, when there are competing interests or different views about the problem, and when there are numerous co-benefits. In the context of this systems approach, let's think about how we avoid getting lost in translation. We have lots of knowledge about what to do, but this knowledge gets lost in translation and doesn't make its way into practice. We need a map. Unfortunately, we have one. We need to adapt knowledge to the local context, to assess barriers and facilitators to knowledge use, to select, tailor and implement appropriate interventions, to monitor the use of knowledge, to evaluate outcomes of interventions, and to sustain that knowledge usage. Sustained knowledge translation is important for maintaining evidence-informed best practice. This is not a separate process, it's part of the system we're discussing today. Let's put this all together in a prototype systems map. The issue is falls prevention among older adults. These are the relevant demographics, such as ADL function, the activities of daily living. We can identify the relevant medical conditions. We can identify important postural factors. We can identify important psychological factors. We can identify the key settings for intervention. We can identify the important strategies. Last but not least, we can identify key interventions to make. Just to recap, apart from demographics, we can identify relevant medical conditions, postural factors, psychological factors, key settings for intervention, key strategies for intervention, and key interventions themselves. Of course, this map is not a static map, it's a systems map. There will be many interactions and feedback loops. We're not trying to achieve that task today, but we can address that in the future. And we can look at things like agent-based modeling to simulate interventions and changes in investment. Thanks for your interest and attention today.